Have you ever felt a wave of intense emotions that just takes over, making it hard to think, breathe, or even function? It is a common human experience to sometimes feel completely swamped by sadness, anxiety, or frustration, leaving you searching for a way out of the storm. When these feelings hit, it can feel like you are lost at sea with no land in sight, but remember, you have tools to navigate these challenging waters. When emotional distress becomes overwhelming, the most important first step is to acknowledge what you are feeling without judgment and then actively seek immediate support. This can mean reaching out to a trusted person or engaging in practical self-soothing techniques to regain a sense of control and safety. Prioritizing your well-being in these moments is not a luxury, it is a necessity for emotional resilience. The reason this approach is so effective lies in our brain's stress response system. When overwhelmed, our sympathetic nervous system kicks into high gear, flooding our body with hormones like cortisol and adrenaline. This fight or flight response can hijack our rational thinking. By taking deliberate actions to seek support or calm ourselves, we activate the parasympathetic nervous system, which helps to slow our heart rate, regulate breathing, and restore a sense of peace. This shift allows our prefrontal cortex, the part of our brain responsible for planning and problem solving, to come back online. Practically speaking, there are clear steps you can take. First, connect with a safe person like a friend, family member, or mental health hotline. Just talking can diffuse some of the intensity. Second, engage your senses with grounding techniques. Try holding an ice cube, listening to a specific song, or focusing on 5 things you can see, 4 you can touch, 3 you can hear, 2 you can smell, and 1 you can taste. Third, remember to breathe deeply and slowly, using your diaphragm to expand your belly as you inhale and exhale. Finally, if the overwhelming feelings persist, consider scheduling an urgent appointment with a mental health professional, as they can provide tailored strategies and support. These are not just quick fixes, they are evidence-based strategies rooted in cognitive behavioral therapy principles. For instance, redirecting your focus to sensory details can interrupt a cycle of negative thoughts, a key concept in thought challenging. Moreover, understanding your personal warning signs, often called triggers, and having a pre-planned distress tolerance toolkit can significantly reduce the duration and intensity of future overwhelming episodes. This proactive preparation empowers you to recognize the onset of distress and respond effectively before it escalates. Ultimately, recognizing when emotional distress is becoming too much and knowing how to respond gives you back your power. By combining immediate self-care with intentional connection and, when necessary, professional guidance, you are building a robust system for managing your mental well-being. These actions reinforce the message to your brain that you are capable of handling difficult emotions, fostering a deeper sense of inner strength and self-compassion for the long term.